Now to my explainer tonight, and it's about a grave situation in the country. You see, we have reported some cases of cholera in the country over the last few months, and it's important to talk about why this should be of concern. You see, cholera is on a list of diseases known as notifiable diseases. These are the ones that are a threat to public health. Others on this list are Ebola, the Marburg virus, dengue fever, anthrax, and polio. Now, these groups of diseases are treated very differently from others. When an outbreak is reported, there's a certain protocol that kicks in to quickly contain the disease. And this is because cholera is a highly infectious disease that affects both adults and children and can kill within hours if left untreated. Now, one of the things that's important to note as well is that it only takes one reported case for it to be declared an outbreak. So let's talk a little bit more about it, right? These are the numbers as at February this year. The country had recorded over 4,800 cases of cholera with 85 deaths. Now, this is since this current outbreak last October. Now, that's these numbers over a 5-month period alone, all right? Now, this current outbreak, let's trace that to October last year. The origin is thought to have been a wedding festival in Kiambu County, which, according to IFRC, recorded 31 cases. Now, this later spread to Nairobi, Murang'a, Kajiado, Nakuru, and Uasin Gishu. Now, at the time, the cases were relatively low in number and not as severe, and the county governments had them under control. But by December of 2022, a spike was noted in the counties of Nairobi, Tana River, Garissa, and Wajir counties, with some of them even requesting support from the Kenya Red Cross. Now, in this latest outbreak, we have seen cases reported in Thika Prison, with 38 inmates contracting the disease over the past 1 week. 9 are admitted in hospital. There have been no fatalities reported there. Meanwhile, in Kisumu County on Wednesday this week, 8 cases of cholera were reported. 2 persons, unfortunately, have died. According to health officials in that county, 52 patients showing symptoms of cholera have been treated, with Kisumu County officials having launched an emergency control center to curb the spread of the disease. And just today, Siaya County has recorded its first case of cholera in this particular outbreak. 1 male confirmed with cholera who has been treated. 1 case. Remember what I said earlier about just 1 case needed to confirm an outbreak? That's important. Well, all of these figures aside, some important information for you. How do you know if you are affected or infected? These are the symptoms. A sudden onset of diarrhea, which can be quite acute and that can quickly dehydrate the body if not quickly treated. Patients also experience a dry mouth as a result. Others include vomiting and nausea. Now, it is this rapid loss of body fluids that can lead to kidney damage and eventual death. In extreme cases, we've seen death occur within 4 hours of the onset of the symptoms. That is why, if you notice any of these symptoms, go to your nearest hospital, especially now that there is a cholera outbreak. Do not go to the pharmacy. Get yourself correctly diagnosed by a doctor and then get treatment, which is mainly rehydration, giving you fluids to replace those that have been lost during diarrhea. There's also an antibiotic treatment, which is fairly affordable and easily accessible. Now, cholera, remember, is easily treatable, despite everything we've said, and most importantly, can be prevented. It is contracted from a contaminated water source, and this latest outbreak is said to have been caused by the prolonged drought and the inadequate safe water sources. So, prevention includes water and sanitation measures, simple things like using clean, boiled drinking water. Look out for fruits and salads. Those can be pretty dangerous at this time because they may carry the bacteria that causes the disease. Make sure you keep all food covered and practice proper hygiene. Wash your hands before eating and after visiting the toilet. Vaccines, by the way, are also available. Now, Let me mention here that there is no government intervention yet with respect to vaccination, but it can be accessed from private sector distributors for about 1,550 shillings. Now, let me end this by correcting this misconception that many people seem to have about cholera. Cholera is not a poor man's disease. In fact, in previous outbreaks we've seen in the country, including like in 2019, it's affected all Kenyans from all walks of life. Outbreaks have been reported in high-end hotels as well. Now, it is a highly infectious disease and spreads fairly quickly, and that is why we all need to take note of the necessary precautions during this cholera outbreak. That's my explainer tonight.